Awesome. Well, hi,
And,
everyone.
sorry. Hi, everyone. Thank you so much for joining us today. Today we have Dr. Anwar joining us, and she is an orthodontist. Thank you so much, Dr. Anwar, for taking time out of your schedule to meet with us today. And whenever you're ready, you can take it away.
Awesome. Hi, everyone. My name is Dr. Neelab Anwar. I'm excited to be here, and thank you, Dental Shadowers, for putting this on and just for all that you do. I wish I had this in college because it's just so helpful to hear about other people's journeys, and especially from people who've been through it already. So this is great. Think of any questions you guys may have, and hopefully we'll address them after. So a little bit about myself. I was born in San Diego, California, grew up in Orange County in Southern California, and then we moved to Temecula. That's north of San Diego, did my high school there. And then I commuted from home for college, went to Cal State San Marcos, north of San Diego, did my dental school in Los Angeles, and then I got into my ortho program in Rochester, New York, in upstate New York. And I'm currently working in Buffalo, New York. So that's also in upstate, almost an hour away from Toronto. In my free time, I love playing tennis, the piano, traveling, spending time with family, friends, my husband, love shopping. So I'm excited to talk to you guys today. So a lot of people ask me this, how did I even get into dentistry and why ortho? So in terms of general dentistry, ever since I was little, I have many aunts and uncles who are general dentists. So growing up, just kind of seeing them so happy and in their element, seeing them with patients, and I would always be at their office. It was nice, and I wanted to be a part of it. But ortho specifically, me and my sister, we are always just fascinated with braces for some reason. We would like pretend we had them and, with gum on our teeth. It was just funny. So we always loved the idea of having braces. And then I had them in middle school. And once I got them off, it completely changed my personality, boosted my confidence. And that was when I realized I wanted to be a part of this specialty. So early on, and then that was solidified when I started shadowing in college, early college, and just like seeing the self-esteem, boost and the impact you have on the patients every day is just so gratifying. Seeing them, when we take the braces off, just glowing is huge. We see people who are bullied and they have, many psychosocial issues, and just being able to change that is so gratifying. Also, what I love about ortho is the relationships we have with our patients and their families. So an average ortho treatment is typically around 2 years, and we see our patients like about every 6 to 8 weeks. So you really get to know them, and especially their families. So that's so nice for me. I love to see them grow and mature. And then number 3, the lifestyle as an orthodontist. So it's really nice because you have a lot of flexibility with your schedule. It's so nice because if you own your own practice, you can literally be open 3 or 4 days a week. You don't need to work 5 days a week to be successful. So you have tons of flexibility. And also, it's not strenuous on your body. Many of the tasks during the day are done by your ortho assistant. So changing the wires, taking the braces off, taking the records. So your assistants do a lot of that. So it's not physically, and mentally draining. So it's really nice. And, honestly, even as a hopefully future mom, it's nice because with ortho, you have that option to, work even 2 or 3 days and you'll be, just fine. And you also have time to do other things that you enjoy outside of work. So this was my personal journey. So I'll start with my undergrad. So I went to California State University, San Marcos. It was a state university, again, like I said, north of San Diego, finished in 4 years. I was grateful I got into dental school right away. Graduated dental school in 2018. That was 4 years. And then I was really lucky. I got into ortho residency right away, and my program was 2 years. Okay. What you will realize here is that I did go straight through school. I took no breaks. This typically today is not the norm. I know people who traveled after college before dental school. I know people who did a research fellowship. I know people who applied to dental school 2 or 3 times, and that's okay. I know someone who practiced general dentistry for a few years now and now wants to go back to school to become a specialist. So no journey is right or wrong, okay? So it's really up to you in the end. And honestly, just, follow your dreams and you'll be okay. Don't compare yourself to others, and just keep this in mind. So I want to go into what I did specifically in undergrad. So again, graduated in 2014. I was a bio major with an emphasis in physiology. Again, you can major in anything to go into dental school, but as long as you complete the prerequisites, the science prerequisites, and then, but bio really helped me, like for the DAT, and also in dental school, you'll see a lot of the classes keep like repeating. So that was helpful. Starting in college, I really wanted to, always be involved. I, found a predental society right away, and I was able to have a leadership position there. And then I was part of other, a few other groups like Pre-Health Society, a few other service groups. And in my free time, I also tutored in chemistry, organic chemistry, biostatistics. And then in undergrad, so if you know you want to be a dentist or go into dental school, you should be shadowing general dentists. In my heart, obviously, was ortho, but you need to do one thing at a time. So shadow general dentist in your free time if you can, see if you love it, okay? It was nice for me with my best friend. Twice a week, we would also volunteer at a low-income dental clinic. So we would be able to assist general dentists. And then on the weekends, we would teach oral hygiene to the children waiting for their appointment. And I was always trying to be involved and help my community. I organized like so many homeless shelter drives, and even like going to Mexico, taking food and clothes down there. It was just something that I was passionate about. And one thing to also keep in mind is to build relationships with your teachers and faculty in college. Again, if you know you want to go into dental school, you're going to need letters of recommendation. So always keep that in mind. Try to go to office hours maybe. Show them that you're a hard worker. Show them that you're very passionate about what you do, and that will really help. And then for dental school, you need to take the DAT, the dental admissions test. If you want to get into dental school right away, I would take it a year before you graduate, just to make sure you're doing things in a timely manner. And dental school, graduated in 2018, went to USC in Los Angeles. It's a private school. So dental school is a whole different ball game. Okay, it's not easy at all. The first 2 years, you're doing your didactics, your clinical exams, and exams from like your lectures and everything. So not only are you studying, with the books, but you're also in the laboratory. You're practicing prepping crowns and doing fillings. So it's stressful. So you need to balance your time accordingly. And now, obviously, when I got into dental school, now I was like, okay, I want to focus on following my dream to become an orthodontist. So from day one, I had that, in my mind, ingrained in my heart. And I, try to keep my grades up. I was volunteering. I was in different groups. So from day one, I joined our ortho study club and eventually had a leadership position there. That was really, really helpful. And then also, probably I would say the first few years, although you will be busy, it's good to keep in mind to decide if you do want to specialize or not. So I was shadowing orthodontists in dental school, and I went to our ortho department occasionally. They were just like on the same floor as our clinical lab. So sometimes I would peek in and help out. Let's say you want to be an endodontist, oral surgeon, pediatric dentist. So you can shadow them during this time if you can. Doesn't have to be first or second year. You can easily shadow them later on as well. But if you want to get into a residency right away, then the sooner the better. Research is looked highly upon for some ortho programs. So again, from day one, I started with one of my faculty in the ortho study club on a research project, and eventually I was published with that, which was nice. And then I was able to present at our annual research day, which was really a big honor. So like sometimes you need to make a big poster presentation, and it's really a big honor. And again, I just want to highlight this is you really want good relationships with your faculty, and you can meet, your mentor in dental school or even college. So just kind of keep an open mind and just work hard and kind of get to know people. It was nice for me. I met one of my mentors in dental school, and Dr. Kyman, he was the one that actually talked about Eastman, the ortho residency, and he said such great things about it that like actually intrigued me to even apply there. So that was a huge deal. And then again, if you want to get in right away to a residency, apply at least a year before you graduate. So I applied summer of third year. Again, for ortho, this is important because each program has different requirements. So you want to stay organized and make a spreadsheet. That's what I did for each program's requirement. So some needed GRE, some needed an ADAT. I don't know if they're still requiring that at the time. It's another exam. Some need 3 letters versus some need 4. Some need a payment, some don't. So I would just really make sure you're organized with that. And then the GRE is required, like I said, for some programs. I'm not sure why, but I took it early on, like second year of dental school, to just get it done and have it ready for my application. And again, just remember to have like a timeline for yourself, stay organized, because you need your personal statement, letters of recommendation, a nice CV. My personal statement, I started it probably like end of first year of dental school. I had like 13 to 15 drafts, and I really, really worked hard on it. So it takes time. And again, if you do want to get in right away, the sooner the better is my advice. And then in dental school, one thing I forgot to mention, my class, you had like 140 students total. You have a lot of people who are trying to specialize, do similar things as you. Do not get overwhelmed and do not compare yourself to others. Really stay grounded and follow your dreams, and it really will pay off. Okay. And then finally, one of my favorite parts of my career, I got into the program of my dreams, my top choice, Eastman Institute of Oral Health at the University of Rochester. Just graduated June of 2020. This program is really competitive. Reason being, I mean, it has a really good reputation. A lot of the alumni from this program, they're really well known in orthodontics. And also it's a 2-year program with a stipend, meaning you get paid. Many ortho programs are 2 to 3 years, okay? So that was huge for me because you can finish a year early and still get the same experience. Most ortho programs, they have 4 to 10 spots. My program had 6 seats, but 2 out of the 6 are for international candidates. So pretty much 4 for me. So it's really competitive. Typically they look for, you to be at the top of your class in dental school. I wouldn't get overwhelmed by that. Again, I would really stay grounded and try to be an overall well-rounded applicant. Don't let that overwhelm you, but ortho is one of the more competitive specialties. In residency, it's like a dream because you're doing finally everything that you've wanted to do since you were little. So you treat patients, they treat you like a doctor. I started like 85 to 90 of my own patients. And then you have like a big SIB, somebody above you to transfer their cases. So treated about 45 to 50 transfer cases. In residency, you do different presentations. Again, you treat patients, you do a research project, and it's really nice. You have more free time in residency. And again, like every day I'd wake up and just excited to go to work. It was nice. And then you do your board exam, and then your last year you apply for jobs. I met my husband there. He was a year ahead of me, and it's just crazy because he's from like DC, Maryland area. I was from California. So that was like, who knew that was going to happen? You're in a very intimate class setting. So you get to know people. And again, you meet your mentors, you develop relationships, lifelong relationships with your faculty and peers. So it's so nice. I mean, that was one of my favorite points of my career. And it's nice in ortho residency, you have like different conferences, and you have, this was actually a wire bending course, the top 2 photos in Arizona. And we like had a house there and would go every day, bend wires, and then come home, have a nice dinner, and you really get to know your colleagues. And then different companies also, like sometimes they pay for you for the trip. So this bottom picture on the golf course was sponsored by American Orthodontics. It was nice. There was like a spa day. You had option of playing golf, different activities, and it's really, really nice. And then each year, the American Association of Orthodontics, they go all out in like putting a huge conference on for all orthodontists across the country. So that's really, really great. Advice for pre-dental students. Again, I would just stay organized, starting all the way in college. Get involved, develop relationships with faculty. Some people ask me, well, how do you get involved? In college, I mean, there's club fairs, word of mouth. Talk to people in your science classes or people doing the same major as you, and they will have an idea of different groups that you can be a part of. Shadow different fields, okay? Having an idea of what you want to do when you enter dental school will help you a lot, okay? Make sure you also love it, because it's a huge, huge investment, not only financially, but of your time. And that's okay if you don't know what you want to do when you enter dental school, because in dental school, you'll be able to go to those different rotations and see what you really want to do. And you can even shadow in dental school. So don't worry if you have no idea what you want to do. I had so many friends that entered dental school and they're like, I don't know, like, I just love everything. And they ended up being dentists. Like, that's totally fine. Be involved and well-rounded. Ortho specifically, we look for well-rounded applicants. So we don't want you to be a robot and just book smart. We want you to be overall just, good human being, very sociable. We want you to obviously have good grades and, be involved in leadership, volunteering, but just like, being normal, quote unquote, is huge, because in an ortho residency, it's very intimate. So they want to see if they can work with you for like 2 or 3 years. And they also want to see if you're good with patients and you'll have that rapport with them when you practice. So keep that in mind. It's all about being well-rounded for us. But during, your college time, dental school time, also have some sort of like healthy stress release. So going to the gym, having hobbies, music or Netflix, having your favorite show, because sometimes things get so stressful. And I think that's really, really important to keep in mind. And I kind of touched on this, but I said to finalize your specialty at least by second year of dental school, if you want to go in right away. If you find out later on, let's say third or fourth year, you want to specialize, that's fine. Just plan your timeline accordingly. Okay. And lastly, don't forget to enjoy the whole journey, because time flies. And if I were to tell my younger self something, I would say maybe, although I enjoyed college and dental school, maybe just stop and like smell the roses breathe and just enjoy, because time really does fly. So what is orthodontic? So, I mean, not only do we deal with misaligned teeth and your bites, but also misaligned jaws, okay? We also focus on modifying facial growth, known as dental facial orthopedics. So we diagnose, prevent, intercept, and treat dental and facial irregularities. So it's nice because we treat existing problems, and we can also identify problems that can get worse later on and that are developing, and we can take action to resolve those problems before, again, it gets worse. And it's nice because we treat patients of all ages, mainly children, but also mainly teens and some adults, which is great. I just put this slide in, found these online because I think some people often ask me, but again, just to review, an orthodontist, we have that specialized degree. You need to go to residency to become an orthodontist, to 2 or 3 year program. So we're a specialist in facial growth, dental development, and occlusion, and tooth and jaw alignment. This figure on the bottom here, 3% of dentists are orthodontists. I'm sure that's like increased, obviously, but just so you guys know, we had to go through dental school, and then you have to go to a residency to be an expert in this field. So not only do we put on braces, but we do clear aligners. As you guys may know, we also do what we called phase 1 or early treatment. This is when we treat kids, maybe they're like 7 years old to 9-year-old, and they may present with problems like a crossbite here. I don't know if you guys can see my cursor. A lot of crowding. They could have an open bite from thumb sucking. They can have impacted teeth, so typically impacted canines, as you can see. They can have an overbite. They can have an underbite. Their teeth can be significantly flared. This is an overjet. You can see if there's a ton of overjet here, then they're at risk for trauma. So it's good that we can help with that before it gets worse. And then obviously, these kids will need full braces later on when all of their adult teeth are in. And then we also help the oral surgeon with jaw surgery cases. So if somebody's lower jaw is too far out, protruded, or too far back, we can help, set up the patient for jaw surgery. So a day in the life of an orthodontist. So pretty much what you see in this photo, it's a lot of thinking on the fly. You're diagnosing, you're treatment planning, and you're literally going from chair to chair, talking to patients. So currently, my husband and I, we work in a large pediatric practice. We do ortho out of 3 of them. There's I think many locations of the office, but ortho at 3 of them. And pretty much we see patients. I work 4 days a week. I'm off Fridays. And in the mornings, we have bondings, we have consults. In the afternoon, we have like adjustments, records, retainer checks, debonds, and I'll go into each of these appointments. But it's nice, just one thing to note is right now we're seeing about 50 to 75 patients a day. Some ortho practices see like up to 100 to 120 patients a day. And this is because, we are grateful for our assistants. Again, the assistants help you run the day very efficiently. Okay, so they are able to help with a lot of the wire changes, the record taking, the scanning, the removing of the braces. So they're a huge help for us. And honestly, we couldn't do it without them. But just so you guys know, the range of the number of patients you could see. So again, this is my current day working. I will go into each of these different appointment types. We like to start early, so 7:30 to 5. And then in the afternoon, we see all those appointments, adjustments, debonds, consults, retention checks. I want to go into consults because this is a huge part of orthodontics. So these consults, they could be children, teens, or adults who visit the orthodontist for the first time. Maybe they've been referred by the dentist or another specialist, or maybe there's something they don't like about their smile and they just want to fix it. Or maybe it's just education. Maybe they want more info. So what we do is we take a panoramic x-ray for the consults, and if they want to sign up for treatment, at the next visit, we'll take photos, a lateral cephalogram x-ray, and we'll put the braces on that same day. If they are a candidate for clear aligners, we take a 3D scan with our Trios 3Shape scanner, which you can see here, that picture above. It's so nice. We love it. And there's no more goopy impressions or molds. I know people who've been thrown up on from these impressions. My poor husband, he's a gagger himself. So it's really nice that we have this 3D scanner. So bondings and debondings, this is a super exciting day because this is the day you get your braces on, or debonds are when you get the braces off. So getting the braces on, it's a huge, critical, important day. There's a lot that goes on, and you want to do the right steps to make sure that the braces stay on and your treatment is as efficient as possible. So what we do is we make sure everything's nice and dry. We etch, we wash, we dry, we use a primer before placing the braces. And it's important to do, again, these steps properly. And then these steps are actually similar to doing a filling in general dentistry, but they're just at different concentrations for orthodontics. And then debonds, so pretty much that's quick and painless. When they remove the braces, you could use a plier and then polish all the remaining glue on there. And obviously we take initial photos, we take final photos and x-rays as well. Adjustments, for those of you who've had braces, these are the appointments that are also known as changing the colors. So this is when you come in and we change the colors, but we put in a new wire. This is huge for the orthodontist because this is where you literally make the treatment decision of, hey, which wire do we go in? How is this treatment progressing? Do we take a progress x-ray? There's a lot to think about. Which wire do you go to? I put our wire sequence up here. This is what you'll learn in residency, but there's different wire materials, different wire sizes, depending on the stage of treatment you're in. It's nice, this picture is nicely labeled because some people get confused what is what. The power chain is to close spaces. You have rubber bands here to fix the bite. You have molar bands. We don't use those often anymore. The actual arch wire, okay, which you put on first before putting in the color ties. And then the bracket. So these appointments, it's typically 30 minutes or less. So you got to be really efficient. And you'll see a ton of adjustments throughout the day. Other appointments we have, retainer checks. This is super important because if someone's not wearing their retainer, their teeth can shift, can move, and they'll need braces again or clear aligners. Okay, so that's super, super important. Records appointments, can consist of taking a scan, some photos, taking some x-rays. We have observation appointments. So that's when we see if a child or if someone's ready for braces. Checking an appliance. So we typically use an expander for younger kids just to widen the upper jaw. You can see in this picture here. So sometimes for the appliance checks, we see if enough expansion has been achieved. And then emergencies, we're very fortunate that in orthodontics, there are no, real hard emergencies. The most we'll see is typically a broken bracket or a wire poking, all of which could easily be resolved quickly and very easily. So it's not like medicine where you're like on call or something like that. So salary and adjuncts to the profession. This is a good slide because after residency, you have options with what to do with choosing a job. So you have many different options. Each has their pros and cons. So it's up to you to kind of figure out what's right for you. Number one, you can be an associate in a private office. This is nice. It's probably the more popular option because you get great experience and you have the potential to buy the practice in the future and become maybe an owner or a partner. So that's really nice. You can work in a large corporate practice as a corporate associate. So I don't know if you guys have heard of some corporations, PDS, Western Dental are a few on the West Coast. But it's nice because as a corporate associate, you can have like a full-time job, like 5 days a week, and you don't necessarily have to jump to different offices. So it's nice. The biggest benefit here is that you can get a higher pay and good experience seeing a lot of patients, and it's just at a single company. And then you can also be an owner of a practice. So this is kind of like the ideal option, but it's very costly up front. Obviously, if you have a lot of student loans as well. So that's why people typically work for a few years before opening up their own office. But it's nice because you have a lot of flexibility as an owner and you're pretty much like running the business, it's fun for some people. Aside from working, you can also teach. You can teach as a clinical faculty in a residency or even the dental school in the ortho department. So you have tons of different options. One thing you may notice in the salary ranges is that they do range. It's because orthodontics is very flexible. Most private ortho practices are open 3 to 4 days a week. So if you want to work 5 days, you might need to work at different offices. Also, it depends on where you practice. So different locations have different pay. So bigger cities like New York City or Los Angeles is very saturated. So you may have a lower salary than rural areas. So that's something important to keep in mind. So new technology in orthodontics, this is super exciting because our field has gone like pretty much digital for the most part, and it's just increasingly becoming more and more digital. Like I mentioned before, we have the 3-shape scanner. It's super nice, super easy. You can literally see your teeth right away. And what you can do is, if you guys see this little machine in red, that's a 3D printer. So what you could do is literally once you scan, the scan will be sent to a digital software. And if you have this 3D printer in your office, you can print the retainers in-house and give it to them. And then also it's cool because what you could do is scan the patient, you see their teeth and everything, and then it can be sent to a digital software and you can actually do the tooth movements digitally and plan the case. And then you can print out, let's say somebody's teeth moved because the retainer broke and you just needed, quick, maybe 10 trays. What happens is once you scan and you plan the tooth movements in the software, you can literally print their trays in your office. And then it's super, super nice and efficient. And then also it's nice with the scanner. If you have like a lab, you can easily send the lab and then send your scan to the lab and then they can fabricate an appliance for you and then just mail it to your office. This image in the lower left here, it's called indirect bonding. What you can see in this image, this is also pretty cool because what you can do is, again, scan the patient and then online. So there's like a little software for different companies. And what you can do is pretty much place the bracket in an ideal position online. And what they do is they'll send you this like mold, a silicone kind of clear mold. And then pretty much all the perfect bracket spot is already there. So you as the orthodontist put in the braces that day and you just seat the whole tray in the patient's mouth and then light cure. So it's super quick in the chair. So that's also awesome. It's a lot to look forward to. In terms of the future of orthodontics, it looks bright because the technology, like I said, is just becoming more and more digital and just advanced. There is a lot of competition. You will be seeing, I think, more and more orthodontists. There may be saturation in like different cities, but the important thing is to set yourself apart. So don't become overwhelmed or worried, that there's an orthodontist maybe 2 blocks away. Just really focus on why you're in this field and really what makes you special. So I'm going to go into some cases with you guys. So generally, patients can come in with crowding. They could come in with overbites, underbites, open bites. What you could see in this picture here on the top, so you can see a lot of crowding of the teeth on the top and bottom. You can see her finished photos here. Everything's nicely aligned. And, in this case, some people would even say, oh, she might need some teeth taken out. But it was nice with the braces, we were able to make nice room for everything, and the patient was really happy. And then taking a look at this picture on the top here. So both of these cases on the right, so they're early treatment, phase 1 cases like I was explaining. So typically children ages like 7 to 9 years old, typically. This picture on the top, so if you take a look, the top teeth are behind these bottom ones here. And if you can see, the gum line of the 2 bottom teeth are lower than the other teeth. This is called recession. And if we just were to keep this or leave this alone, this patient is going to keep biting hard on these bottom teeth, and potentially these lower 2 teeth can become loose or even like fall out if it was severe. So this was super nice because we were able to alleviate this, and later on with the full braces, their treatment will be so much more efficient. On the bottom here, so this open bite, this was a thumb sucker, and it was sad because this patient apparently couldn't eat really well. It was just really uncomfortable, and this habit would just not go away. So we made an appliance for him, kind of like a thumb crib, and then we put some braces on the front 4 teeth and 2 in the back as anchors to help close his bite. So you can really make a difference. And it's nice because in ortho, we can see everything. Like I was saying, from children to adults, it's nice because you play a huge impact and make a huge impact on their lives. This patient was a surgical case of mine in residency. I want you guys to look at her profile first. Her lower jaw is a bit more protruded. You can see her big underbite here. You can see these smaller shaped laterals. They're called peg laterals. Okay, it's typically genetic, but they're smaller in size. So obviously not happy with the smile, not happy with the profile. This was a skeletal underbite. So it was something that required jaw surgery. And also in terms of, changing the profile, you are going to have to do jaw surgery for this case. So what we do is we put the braces on all the teeth, level them out nicely for the surgeon. Before surgery, we put little hooks on for rubber bands later on, and we work hand in hand with the oral surgeon, discuss the case, look at their models, and then pretty much they see the surgeon, they do the jaw surgery, and then after the jaw surgery, they come back to the orthodontist, and as the orthodontist, you're the one to finish the case. And typically what you do after surgery is a lot of rubber bands. You might do some bends in the wire to make things look nice. So this was after surgery. You can see a huge impact with her bite. And, she was so much more comfortable and everything. It was great. And then you can see the small laterals are still present, but for the peg laterals, you can typically get them restored by a general dentist or prosthodontist towards the end of treatment. And you can take a look. This was after surgery. So huge difference. And honestly, it looks really, really good. So you have an ability to help, with a change in the profile and just such a more functional and comfortable bite. This was another case of mine. So again, you can see that huge underbite, but this underbite was actually more of a dental issue, so not skeletal. So what we decided for him was to try to correct this bite with braces and an appliance called the Carrier appliance. You guys will see that on the next slide. But before proceeding, I mean, you can see underbite, you can see crowding on the top and bottom teeth. And then this is a hand wrist radiograph. So this is an awesome tool to use. We use this a lot in residency, and you can actually assess the skeletal maturity of an individual with this radiograph, which is super cool. And Dr. Fishman, he was an alumni from Eastman, my ortho program, and he actually developed this analysis to assess the skeletal maturity. So it's pretty cool. So many patients, when we take that x-ray, they're like, oh, wow, this is awesome. They're like, is that my hand? Yeah, but that's a really good tool to have. And then this is a lateral cephalogram. You learn to hand trace these in residency and digitally trace these. All of these lines, they signify like different angles, different measurements, could be of the teeth or the jaws. And the jaws in relation to each other as well. So knowing these numbers really help diagnose and treatment plan. And then again, this is just the measurements from the lateral cephalogram. So like I said, you'll learn all this in residency, but they're really, really nice tools to see the position of the teeth or certain angulations of the jaws, and you can really kind of make that proper decision with your treatment plan. So really helpful. This was the Carrier appliance. You can see the lower bar on the bottom teeth. So the Carrier helps correlate and correct the bite with rubber bands. So obviously you need patient compliance a lot in ortho with the rubber band. So they need to wear it, to have an efficient treatment. So this was, where we were at. And then after, you can see it was so exciting. Underbite was fixed and they were just so happy. And his bite was just, so much more comfortable. So this was awesome. That's a really good appliance. And again, efficient if the patient is compliant. Another case, as you can see, so crowding on the top and bottom teeth. Some might say, wait, how can we fit all of this in? This is tons of crowding. And also in this case, her top and bottom teeth were flared. So we say that they are proclined a little bit. So you want to be careful in terms of your treatment plan and not make that worse. You need to be in really, really nice control throughout the treatment to make sure that everything's controlled properly. In this case, we decided to take out a lower incisor, a lower tooth here. You can see there, and you can't even tell in the bottom photo. I'm excited to see final images of her, but this was just, it was really nice because we really, really controlled the position of her upper and lower teeth. And it's nice because by taking out that lower, not only did we fix the crowding, but we made the position of the teeth on the lower really in a healthy position. And then this case is awesome. If you see her profile here, just take a look at the lower jaw. Very, very far back, protruded, okay? And then also you can see a lot of crowding. Doesn't look like it on the bottom, but based on this x-ray here, again, her teeth were significantly flared, okay? They were far forward. Sometimes you don't wanna make them more forward because it's not healthy for the bone, okay? So you have to be careful. In this case, she had teeth extractions being done, and also she used an appliance called a Herbst. So this was a really, really efficient appliance. I mean, you have to wear it for like 8 to 9 months, ideally done during puberty to really take advantage of that growth spurt. But pretty much it's like a metal framework that's like uses a telescopic mechanism. So it exerts like a backward force to the upper jaw and then a forward force on the lower jaw. So it works really nice if they wear it. And then you can see her final images on the bottom. So huge improvement in profile, and her teeth, I mean, they look great. nice socked in bite on both sides, and she was really happy. And just some general advice, follow your dreams. At one point in dental school, I thought it was impossible. Everybody was like, oh my gosh, ortho is so competitive. They only take the top of their class. And it was like overwhelming because you start to compare yourself to other people in dental school. Everyone's doing the same thing, but don't compare yourself and just do you. Write down your goals, make timelines, stay positive, organized, and lastly, just enjoy the process because time flies, honestly. And sometimes I want to go back and relive it, but just enjoy the journey. I am currently working in Buffalo, New York with my husband. We're excited for the future. We just made a professional Instagram page. So feel free to message us any questions. I know a lot of people have already, which is awesome. And we hope we can be a help to you guys. So yeah, feel free to message or email. Thank you guys for having me.
Amazing. Thank you so much, Dr. Anwar, for the wonderful presentation. I really enjoyed all of your cases and kind of your background about getting into orthodontics. And now we're going to take a few questions from the YouTube live chat.
Yes, thank you for that presentation. And we do have a couple of questions. So I guess the first question is, what if dentistry isn't popular during my undergrad? Should I consider transferring?
What if you're, I'm sorry, I couldn't hear the beginning.
What if dentistry isn't popular in my undergrad? Should I consider transferring?
Oh, like as a predent, the courses, or what do they?
I think they're talking more about like extracurricular activities or maybe just in general, like predental culture.
Oh, okay, I see. Yeah. So again, even my university, it was a little bit newer. So sometimes if there's no like a lot of predental stuff, maybe you can start your own predental group. So that's why I loved my university, because I was able to spearhead so many different things. Also, I went to another university. So UCSD in San Diego had a huge predental group. So we were there once a week, and that's also good to look into. So maybe look into other universities that can have predental opportunities. And then just email like dentists in the area. Hi, I'm a college student interested in dentistry. I'd love to come shadow you. You can even call different offices, and the front desk will answer, but you can really get, they'll pretty much transfer you to the dentist. So that can help.
The next question is, how did you study for the DAT?
The DAT, I studied for about, I would say 3 to 6 months max. I remember like going into Barnes and Noble, and I bought like 2 prep books, and I just went through them, both of the books, but then I also took tons of practice tests. I think it was called Crack the DAT. So I would look into that, take tons of practice tests and time yourself, because that was really helpful for me. And the day of, you're not as nervous. So.
Do you usually get paid during ortho programs, or does it vary with schools?
So yeah, it varies with schools. Not every program pays, unfortunately. So that's why it's a little bit more competitive. And then sometimes the paid programs are hospital based, so it's linked to a hospital. But you can take a loan or just kind of help pay for residency. But yeah, not all are paid.
Do orthodontic assistants require specific certification, or do you train them?
Ortho assistants, so I know it varies from state to state. We train them thoroughly when they start to work with us, but they do need specific training prior. I'm not sure exactly what, but each state has different regulations and rules. I know our staff, most of them are hygienists, dental hygienists. So they can do a little bit more, or, they can clean the teeth as well. It's nice because they can explain oral hygiene and stuff like that. So some orthodontists, I know they have hygienists as their assistants, or dental assistants, but they obviously need to train the dental assistants specifically to ortho, with everything ortho.
How do you know where to specifically place the bracket on each tooth?
Yeah, so in residency, they go into that. It's just every millimeter counts. So ideally, you want to place it in the center, but it can vary case by case. Each case is different. I use a measuring gauge, specifically for orthodontics, to measure from the incisal edge of the tooth to the center where I want it. It depends on the case. So like in an open bite, you'll learn this in residency, but if you want to close the bite, you want the braces a little bit higher to push the tooth down. In a deep bite, you want to put the braces a little bit higher to push down the teeth and open the bite. So it's kind of a lot of biomechanics, and they go into detail with that. Before you treat patients in ortho, you practice on like type-it-ons on fake teeth, and it's really, really helpful.
Do you have to have no cavities to get braces?
Ideally, yeah. What our kind of policy is, or what we tell our patients, is that we want a nice clean mouth, and then all the cavities to be taken care of prior to the braces. Sometimes when you have the braces on, the general dentist can't get in between to fill the cavity. So it's just best to get everything taken care of prior and just have a healthy mouth that we're working on.
Do you think orthodontics is more difficult than dentistry?
That's a hard question. I love orthodontics because it's more focused, I would say. General dentistry is very broad. I mean, you have endodontics, you have root canals, you have crowns, you have fillings, you do cleanings, you do root canals. So it's a lot in general dentistry. Orthodontics, it's not easier, but I like how it is more focused. But we're focused on, again, just the bite, the jaws, misaligned teeth, and also modifying facial growth and helping with jaw surgery cases. So it's a little different than general dentistry in that regard.
Did going to a state school matter or impact your undergrad experience?
No, I found that it worked out for me. I would recommend for undergrad and dental school to kind of go to, a financially good in-state program. So in California, like either state universities or UC programs would be ideal. Even for dental school, it's just nice to kind of manage financially where you want to go ahead of time, to keep in mind all the loans and everything like that. But going back to your question, the state university was fine for me, but I did have to stay organized, and I made sure I got all my classes, because sometimes, like if they were to be full, I was really persistent in trying to get all of them, all my science courses. And I would say persistence is key. If you set your mind to something, you will achieve it. So I didn't let anything kind of get in my way in that regard.
The next question is, how do stress levels compare during undergrad, dental school, and practice?
Oh, that's a good question. Undergrad, I would say for me personally, I loved it. It was nice because I was able to, really enjoy, I guess, my science courses while also exploring dentistry. And then I met one of my best friends there, so it was awesome. And she also dentist now, so it's really, really nice. Undergrad was stressful in terms of the exams and everything, but it wasn't too bad for me. Dental school, I think, is the most stressful, especially the first few years, because you have to manage your lab time, your exam studying time, and then also if you want to specialize, you have to keep that in mind as well. So for me, it was a lot. But in dental school, the last few years, it was nice because you're in the clinic, you're treating patients. So it was exciting. It was more positive. But I think the most stressful is dental school for sure. And then working, the stress, like, sure, some days might be long and like, you're going to see a ton of patients, but again, you're doing what you've always dreamed of doing. And it's really nice. Like I love working currently. I graduated in June. So yeah, it's about 6-7 months in practice and it's really nice so far.
Do ortho residencies teach you how to use all the technologies you talked about?
So they do, for the most part. Each program is different. In our program, we had an iTero scanner, so different scanner than currently what we use in our practice. We do have a 3D printer, or we did at our residency program, so you have some exposure. Indirect bonding we had exposure to. So honestly, I think we were kind of spoiled because our program was really clinical focused. Really clinic heavy. So we had like tons of guest speakers and we had lectures, about these different technology, different procedures. And we also were able to try different like bracket systems too. So different, types of braces and clear aligners as well. So it's nice we got exposure.
What are the causes of jaw pain and a bite that does not line up? What can you do to treat that?
The causes of jaw pain. So could be a lot of causes. What you can do is, obviously refer to a TMJ specialist. Some people, it may be caused by stress or, kind of internal like derangement with your jaws or the condyles in your joint. So in those cases, sometimes you would make a clear kind of splint, almost looks like a mouth guard to kind of help relieve that pain. Some people might give over the counter, so like NSAIDs to kind of help with that. But yeah, typically you can also refer to a TMJ specialist.
Is treatment done in steps? Like if there are more than one issue, is every issue fixed at the same time?
So in terms of orthodontics, so it's kind of in phases. So let's say there's a ton of crowding, like you guys saw. First step is kind of aligning everything nicely with a light wire, really flexible wire. And then second phase, what we do is we use like rubber bands, make sure their bite is really nice. Before going to that phase, we also take a progress x-ray, a progress panoramic radiograph to make sure like all the root positions are okay and everything looks nice, probably like 6 to 8 months into treatment. And then, like I said, we do rubber bands. And then lastly, the last stage is kind of like finishing and detailing. So this is where you do more of like the cosmetic aesthetic concerns. So like bending in the wire, moving, a tooth maybe up or down, rotating it in or out. So those are like the 3 main phases. And then you can't forget like the progress x-ray as well.
Could you talk a little bit more about the research project you did during residency?
Yeah, so in residency, it's nice because you can focus more on like orthodontics. So mine had to do with like lateral ceph x-rays and pretty much different patient ethnicities. And I used a certain measurement, like the cranial base angle, and I compared it across the different ethnicities. So it was nice. I had to do like a little poster. I had to do a presentation on it. And I was chosen like for this resident scholar award program, but with COVID, that conference was canceled. So in residency, typically you do have to do a research project, but it's nice because it's kind of up to you. Whatever you're interested in, you can kind of work on that. And then you have typically a faculty mentor working above you, and they need to approve, each step as you go on. So that's really nice.
I think that's all the time we have for questions today. So thank you for answering everything.
Yeah,
Thank you.
Thank you guys for having
Thank you, Doctor. Yeah, it was so nice to have you today, and thank you for taking the time to prepare the presentation for us. It was really informative. And thank you everyone who joined us today. Yoon will go ahead and post the quiz link in our YouTube live chat, and be sure to look out for next week's schedule tomorrow. And yeah, I hope you all have a great night, and thank you again.
Awesome.
Bye everyone.